insulin potentiation therapy is the name of a medical technique. It's not a specialty. It's not a magic procedure. The doctors who administer this technique need to know all about insulin. Insulin is a normal hormone that it's made in our pancreas, has a combination, very specific combination of amino acids, which are proteins, and they have a function in the body. And that function in the body is to open the cell membrane, allowing the exchange between what's inside of the cell and what's outside of the cell. Inside of the cell is the disease. Inside of the cells, it is filled with mitochondria, a lot of organs that work and produce chemical substances. So the insulin inside produces a lot of chemical substances that has to release into the bloodstream. So insulin, what it does, it facilitates that exchange. So the nutrients come from the blood vessels, go into the cells, those nutrients are absorbed and they end up being another substances depending on the specific tissue, and then they are released. The disease happens only inside of a cell. If the cell gets sick or ill, it's inside, and the cause of that disease is because the chemical substances that are being produced are not produced, the quality is low, or there is a deficiency, so they end up creating a disease, which is an alteration of many chemical and physical conditions inside of the cell. If it is a tumor, what they do is they lose the control of apoptosis, which is their time of life. So managing insulin requires to know how to use it, what are the effects, how to combine with which medications, because not all the medications, not all the substances are going to work inside of the cell. Some natural substances might work on the outside because they are waiting something coming from the inside to trap, transform, and then go back, which is called the activation property. So it is important to understand what is insulin potentiation therapy. It's a technique, and the doctor who administers insulin potentiation therapy is familiar with the administration of insulin into the human body. It's familiar with which drugs to help treat a particular disease are needed, and if those medications are going to work with the pre-administration of insulin.